I'm back again. Now I will give you some more information about the infertility, the causes of infertility, and the diagnostic methods, and also treatment plans. In the previous video, I told you that don't jump into the IVF technologies when you think it's easy. It may give you the pregnancy result in 1 month. It may solve your problem as soon as possible. But you have to think that even if you have the best, couple to be getting the highest pregnancy results, the first, even if you are the best suitable couple, you may get up to 50 to 60% pregnancy rates. This is the real results in IVF. If somebody is saying to you that, okay, you could be pregnant in 100%, don't believe. There are some technical issues. There are some statistical problems. And the economical problems. If you cannot achieve the pregnancy, or you may increase the side effects of the treatment. You may increase the complications of the treatment or complications of the pregnancy, which may happen after the treatment. You have to have a kind of question in your mind, what they should be. If you get very high doses of the drugs, which may improve or to stimulate your ovaries, if you are not, or you are not examined enough, you could have a complication of the treatment named as ovulation, hyperstimulation, which may give you very hard times. Even if it could endanger your health, and you have to stay in the hospitals and whatever. The second is just to end up with the multiple pregnancies. You may like to have the twin pregnancies, but you don't want to have the triples and the more. You think, why? Sometimes you want triples, but nobody can be sure that you could get the 3 babies, healthy babies. Think about that. So I know that in USA, my colleagues are just giving more than enough, let's say. I don't want to say nothing or negative about them, but if you give 4 embryos, you could increase the chance of the twin and triplets or the quadruplets, which is not the success. In our system, or in the Europe, we are just using in a different way, and we are just thinking to get the results of using the one good embryos to get up to 40 to 35% pregnancy rate. This is this. So we have to be very careful with I will tell more about IVF in the next video. So what could be done just before IVF? This is the first thing. You have to have a good sperm test. Getting the information about only the number, or the vitality, or the concentration, and also the morphology of sperm counts, sometimes it's not enough. We have to go deeper and deeper, depend upon your history, your previous, the treatment plans, and your genetics, or the hormonal status, or the habits about life. I can tell you, or I want to share that your genetics, your obesity, eating habits, stress, in the quality of sex, and the, let's say, the quality of sex, understanding about sex, and also some kind of additional immunological, and also, I can tell you, lifestyle, smoking, alcohol, and other drugs can affect the sperm. And even if the age of the male can affect it. I can tell you that when the age of the man is just increasing and the quality of sperm is decreasing, even if the number of the sperms are the same. So be careful. So we can correct these problems using different changes in the life quality, and also some drugs, some supportive additional, some substances. So this is the first. And the lady can get pregnancy. Or we have to think about the egg production and the menstrual periods, previous operations, and the ovarian reserve, age of the lady, and previous pregnancies, abortions, and everything. So we could get enough information about the male side and the female. So we have lots of, the opportunities in our hand. If there is a ovulator problems, we could use the drugs to make the ovulation better. If the sperm, we could correct the sperms. And also, if there is a problem in the fallopian tubes or the tube of peritoneal factors, we can correct it easily. Or you have the cyst, you have some kind of, endometriosis, polycystic ovary, thyroid problems, and the obesity, diabetes mellitus, or any kind of problems which could affect the ovulation. We could correct it. And you may get pregnancy yourself, and also you could get your, the baby without an economical burden. So we do it. We do it. We don't start the IVF because we know that these problems can affect the result of the IVF if we cannot correct it properly. So you think that you can get pregnant if you can without any treatment or with the small help. Please think about that. We have lots of remedies. We have the surgical plans, we have the treatment plans to make you to be closer to the pregnancy.